My name is Alex Alonso Malagon, and my presentation today is on universal healthcare. And the reason why I chose this topic is because, as someone who comes from a low income family, I've experienced firsthand what it's like to not be able to afford health insurance and the struggles that come with it. So, this is a issue that I'm very strong about. So, intro. So, turning the current healthcare system in America into some form of universal healthcare that benefits everyone is a controversial issue that has been argued for decades. In the past years, it has been evident that the current healthcare system is becoming harder to afford. As the rates of uninsured people rise, more people are left without proper medical care and supervision. Not to mention the number of debt people may be left with after visiting the emergency room. It is clear to see that millions of people are living under the poverty line and struggle to find affordable insurance. The government should provide universal health care to everyone to ensure people of all ages and incomes have a healthy healthcare equity. Background. The government first got involved in healthcare in 1965 by providing Americans with Medicare and Medicaid. Medicare is a federal insurance program for people older than 65 years old and people with disabilities. The problem with Medicare is its ridiculous deductibles and co-pays people must pay before the insurance kicks in to help. Medicaid is the nation's public health insurance for people with low income. The problem with Medicaid is that it does not offer stable and full coverage to people since it is dependable on someone's income. Fast forward to 2010, President Obama signed into law the Affordable Care Act, also known as Obamacare. This law provides all Americans with affordable health insurance coverage. Although this is a great example of of a politician trying to provide universal health care to everyone, as the years have gone by, high costs, high deductibles, and an increase in consumer costs have left millions uninsured. And lastly, we can take a look at the billions of dollars pharmaceutical companies and private insurers are making due to record high prices on life-saving medications. It is obvious that the current healthcare system is not a new issue and it needs to be replaced with something that works for everyone. Government and healthcare. Currently, the federal government plays a role in healthcare as a regulator and provider of healthcare services. Despite these roles, healthcare is steadily becoming harder to afford. The government needs to provide better and more affordable healthcare to everyone to ensure healthcare equity throughout. According to an article by the Washington Law Review, pharmaceutical companies and insurers have increased their profits at the cost of people paying higher prices for life-saving medications. This just makes it harder for someone to buy medications even while insured. In other countries such as Japan, where healthcare is universal, the cost for an MRI is about 160 American dollars compared to $1,700 in America. If America passed legislation to negotiate prices with pharmaceutical companies, prices for medications and procedures would be more affordable. The involvement of the government in healthcare should be expanded because it is essential for providing a better system that works for everyone. Low-income communities. Furthermore, many people in low-income communities are not able to afford healthcare, as it is crucial that everyone has access to healthcare for a better quality of life. In areas with low-income communities, for example, people of color have trouble finding healthcare providers who have sufficient knowledge of guiding parents through gender affirmation care for transgender people. The government has a responsibility to provide equal healthcare to low-income areas where factors like discrimination, poverty, and stigma already exist. Private insurances and pharmaceutical companies. The healthcare system in America presents many challenges to people. People face things such as paying high premiums or not being able to afford healthcare overall. One major impact that COVID-19 had is drastically raising premiums, so the amount that you would be paying monthly for your healthcare insurance. This increase in premiums would just leave people paying more for healthcare, or even just having to cancel their insurance in general. And with insurance largely tied to unemployment, the number of uninsured Americans has skyrocketed, as well as the increase in uninsured people. Pharmaceutical companies and private insurance also benefit from marking up medications at high prices, and the current healthcare system allows for private insurances to negotiate drugs directly with drug companies. This practice, along with no government regulations, puts many people under the affordable line for insurance, as these prices can be up to 10 times more in America than other countries. And this just shows how unethical it is for insurances to mark up prices on medication when they manage to even get discounts for the pharmaceutical manufacturers. Counter argument. So many claim universal healthcare will lead to a decline in variety and quality of healthcare in America. Another thing to consider is that expanding something like Medicare for all would blow the federal budget, which will result in the inflation and an increase in taxes. Higher taxes with record inflation happening since 2008 will only increase the negative impact that COVID-19 had on the economy as of 2022. Another issue is the disruption of supply and demand that comes with expanding healthcare. This will reduce healthcare services as well as the ability to purchase life-saving drugs. It's also important to consider how healthcare services like medical procedures and doctor's appointments would be significantly affected. And if you take a look at countries like Canada, people are waiting months to receive basic care, including doctor checkups, surgeries, and diagnostics, and even just appointments. So, undoubtedly, the government rebuttal. Undoubtedly, the government providing everyone with universal health care is the right thing to do. If the government already provides universal education, why can't it provide universal health care? By providing universal health care, people would have access to essential healthcare services without financial hardships. One way the government can provide universal health care is by cutting 20 to 30% of the military budget to increase the healthcare budget. This would not raise taxes or blow up the federal budget. And one thing to consider under the current system is that the providers are pushed with less revenue if they actually try to give you the care that you need, meaning they profit more off of you coming back for checkups or appointments rather than giving you the high quality care that you need. Conclusion. In conclusion, providing universal health care to ensure healthcare equity has become a controversial topic of debate in modern society. There are many ways America can reform its current healthcare system to provide universal healthcare. It can be done through regulating pharmaceutical companies and private insurance, or cutting the military budget to increase healthcare budget. Whether it's through direct government regulation or private insurers or the government itself providing healthcare, it has been proven that universal healthcare works. If we look at countries like Finland, the United Kingdom, and Germany, we can see that the quality of life goes up as well as a positive contribution to the economy, as it also helps boost the quality of life for the working class. Just like other countries that offer universal health care to protect their citizens' way of life, America should also prioritize people's health. And for everyone to have access to high quality health care, then the government needs to provide universal health care.